So we launched a national dialogue in December with a website which was open to comments. And then over the last 6 months, we've held a series of public town hall meetings in several cities across the country. At the same time, CMA members were also encouraged to weigh in at what have been 15 physician town halls, including one here held in St John's, which Sue King moderated. On top of this, we've tasked a panel of experts of varying backgrounds to consider options then for funding a transformed system based on this kind of input. The results of this comprehensive pulse-taking, if you like, are being put together in a report that should be available and issued in this coming summer. What was fascinating in all of this was to see an incredible appetite for change in our healthcare system. The public town halls were all packed, the discussion was lively and informed, and the participants included lots of physicians and other healthcare providers, as well as Joe and Jane Public. Certainly this was the case with the inaugural one I attended in Halifax. The attendance at the physician town halls likewise exceeded our expectations, and again the discussion was always productive, as those of you who may have been in a position to attend the one in St John's here will know. Those observers who attended all the meetings reported a striking congruency of themes. The public repeatedly raised concerns about inefficiencies and lack of coordination, about a system that revolves essentially around the provider and the system itself, rather than the patient. Our physician colleagues cited the seemingly universal themes of lack of access to services, widening cracks in the social safety net, patients' inability to pay for prescription drugs, and the terrible burden that illness produces amongst the poor members of society. None of these are surprises to any of you in this room. There's also been much discussion about the Canada Health Act and the 5 principles on which it was based: universality, accessibility, a comprehensive scope, portability, and public administration. And at the very least, there seems to be a general consensus that the Act is badly out of date. With the gaps in care, this, such as drug coverage and availability and home care, are highlighted really as major shortcomings in what is supposedly a universal system of healthcare. But any discussion about transformation seems to devolve almost immediately into a debate over sustainability, particularly into the future. And right now, sustainability too often is defined solely in terms of costs. It's discussed solely in terms of the financial burden that may or may not be placed on the present and future governments. But sustainability isn't just about the money. It's about what the money's going to get us. We've encapsulated this in a definition, and we say it's about universal access to quality patient-centered care delivered across the full continuum, and yet in a timely and cost-effective manner. To put it in local dialogue, it's to the patient about the right care delivered at the right time, in the right place, by the right provider. But it's also about recognising that sustainability of the medical workforce is a real challenge of itself, because there's no value in having financial sustainability if we don't use the resources and improve the overall quality of the system itself. So the year ahead is going to be quite interesting. Despite the initial aversion of all politicians, healthcare did finally figure in the election campaign. The provincial and territorial medical associations, individual physicians across the country, and the CMA were all instrumental in encouraging the parties to actually discuss the future of healthcare during the campaign. Since winning his majority, the Prime Minister has publicly stated his commitment to universal public health insurance, to commencing negotiations on the health accords sooner rather than later, and to engaging the provinces in ensuring that the system is used properly to achieve better outcomes and results. So looking ahead, our goal at CMA now is to see that the next federal, provincial, territorial accord on healthcare amounts to more than just a funding agreement, that it actually translates into some kind of change for the healthcare system. At CMA, we believe there's a strong role in healthcare for the federal government, both as custodian of the Canada Health Act and because of its own responsibilities for delivering healthcare itself. It's the direct provider of healthcare for First Nations and Inuit, the military, the RCMP, and federal prisoners. It spends more than all but 4 other provinces in terms of its expenditure on direct healthcare. So I can assure you that the CMA is going to work very hard over the next year to hold the federal government to account on its role and to advocate for our patients and for the healthcare system. As the time draws near to negotiations on a new accord, it'll be very much up to provincial and territorial medical associations to work closely with their respective governments. One scenario we're being presented with federally suggests that there may be several bilateral accords and not just a single overarching agreement as in 2004. Such a scenario, it would be vital to have the provincial government's views informed by the perspective of the local physicians. That's you. Your engagement and your leadership will be crucially important if we're to achieve an accord that's not just about money, but about outcomes. As a first step, I encourage you to attend our annual General Council taking place here in St John's itself in August. It's one of the benefits of having one of your own as president. GC comes to you, it's held here in your own province. And there's no registration fee. If you want to get your feet wet and attend as an observer, sign up on the day and come down. When I spoke to you last in 2003, as I stepped down from the role that Pat's fulfilled so well this year, it was for us as an association to use the voice that we'd found during our job action and arbitration. This is as crucial now as it was then, because as physicians we have a responsibility to lead the way, to advocate on behalf of our patients for the changes we want and need to see. Politicians are not going to lead. It's up to all of us to set the agenda. Here again is a subject for our voice. We have an election here in October, another chance to raise healthcare in the politicians and the public's mind. We must use our voice, but we mustn't use it just in isolation, but to build a broad coalition amongst healthcare interests and Canadians themselves to push for the transformation of the system that we all see and need. If there's one group that can make a difference based on past performance, it's the NLMA. Its track record speaks for itself. So I'd just like to thank you very much for the opportunity to say a few words tonight. And again, thank you very much for the invitation and putting me here. Thank you.
Each year, the NLMA scholarships and bursaries, and I'd now like to recognise our most recent recipients. I'm pleased to announce that Miss Paige Moore and Miss Natalie Graves are the recipients of the Newfoundland and Labrador Medical Association Awards, valued at $1,000. Paige and Natalie were selected by the Dean of Medicine's Committee on Awards, Bursaries and Scholarships. The award recognises potential interest in the organisation's aspects of the medical profession as judged by the contributions to the governance of Memorial Universities of Newfoundland's Faculty of Medicine. Paige and Natalie received their awards during Memorial University's Scholarships and Awards Luncheon for medical students this past fall. The Dr. Phyllis H. Madriga Scholarship. In 2011, Dr. Madriga Scholarship had been awarded to Ms. Robin Wade. This award is valued at $3,000. Ms. Wade was selected for this award by the Dean's Advisory Committee on Awards, Bursaries and Scholarships and the Newfoundland and Labrador Medical Scholarship Foundation. Dr. Madriga, and some of you I'm sure will remember her, provided many years of dedicated service to the people of rural Newfoundland and Labrador. While she is currently enjoying retirement, she remains a strong supporter of medical graduates from Memorial who choose to stay in this province. The scholarship is awarded annually to a student from rural Newfoundland and Labrador in their final year of medical school who has plans to practice rural medicine. Academic achievement, strong personal values, and leadership within the Faculty of Medicine are also considered. Ms. Wade received her award at the May 26 Memorial University Convocation Dinner and Dance, and my daughter also graduated then. So congratulations to them.